It has been, and this is a very welcome step forward, simply because the Secretary of State has now identified money for public sector pay with the proviso that the Assembly returns. So we feel as if our workers or teachers are one step forward in terms of getting a pay settlement.
So give me some idea of the impact of this psychologically and financially on people.
It's been a huge impact. I mean, one of the things is, of course, that a number of teachers have left the profession. We're finding it harder to recruit teachers into the profession, and those teachers who are left behind are working in circumstances which are underfunded. We have long-term underinvestment, and it's very, very
And this is
difficult.
as a direct consequence of what didn't happen in there.
Well, it's been a build-up over a period of 10 years. But because then we haven't been able to release any additional funding to get any further investment, I think it has exacerbated the situation in recent times.
Tom, what about you?
The health service in Northern Ireland is overwhelmed. It's in a death spiral at the moment.
A death spiral?
Difficulty getting through to your GP, waiting many hours for an ambulance. You go into ED departments and what have you got? 27-hour wait. Trying to get into the wards, very, very difficult. Can't get patients discharged out of hospital because no social care
Not unlike what we're
packages.
seeing in England.
Everything is twice as bad in Northern Ireland, if not more. Our waiting lists for more than 12 months for inpatient are 11 times worse than the Republic of Ireland. And that's part of our problem. Pardon me. There's huge funding going into the health service in the Republic of Ireland through Sláinte Care, and our doctors, our nurses, our physios, our radiographers are moving across the border, and we're losing our staff, we're losing our funding, and the workload and the waiting lists. Our waiting lists are so long.
And how angry were you that that what you're describing happened as a result of what they couldn't decide in there?
Absolutely furious, because incompetence that's dormant to this point has wrecked our health service. It's done irreparable damage. There's damage done that we can't fix for 10 years. This is appalling derogation of their duty for the civilians, the citizens of Northern Ireland.
So if for some reason, it seems unlikely, but it's possible, never say never, especially with the DUP, if for some reason this is torpedoed at the last minute, what would you say?
Well, if this is torpedoed at the last minute, then I would call on the Secretary of State to step in and to try to address some of these issues. We know that money has been identified. We know that there's money there to come in to help stabilise public services. And if this isn't going to work this time, what we need is for the Secretary of State to step in and get that money over. I'm not saying direct rule. I'm saying in the meantime, we need our public services stabilised.
I mean, because it's not just the economic and the social context, there's the political context as well. Everyone keeps referring back to the Good Friday Agreement, but there are tensions and there could be real friction, couldn't there?
Yes, but in the end of the day, the most important thing for the public is the health service. That's what they'll say to you if you knock on their doors. The politicians are those that need to take the executive action, get the funding and make the decisions, difficult decisions ahead in terms of prioritising the health service and transforming it, because that's what people need.
I don't know how you voted in the referendum, but Northern Ireland did vote for Brexit, didn't it? I mean, are people regretting that now, even those who voted for it?
Well, Northern Ireland, strictly speaking, didn't vote for Brexit.
Oh, you voted against Brexit, of course. The DUP was in favour of Brexit, I'm sorry.
Yeah, we didn't vote for Brexit. But, I mean...
But do you think the DUP is regretting that now?
Well, no, I don't think so. Not from the stance that they're taking. I don't think they appear to be. But, I mean, if anything, whether it's Brexit or whatever it is that's standing in the way of our citizens having proper public services, proper education and proper health, we need to get it resolved.
Brexit made things much, much more difficult in Northern Ireland, be it through trade, the economy, the politics, providing public services. The UK is not richer because of Brexit, it's poorer, and we're struggling to pay for our NHS.
OK, just very briefly, how big a deal is it for you as citizens rather than politicians that you have a Sinn Féin First Minister for the first time here?
It's politics, it's democracy. People have voted, that's what they want, that's the road we're on.
Jaquie?
Yes, that's democracy, and we will move forward as long as the most important thing to us is to have our politicians working together to get the society back on track.
Fingers crossed on that one. Jaquie White, Tom Black, thank you very much to both of you.